In nursing, we talk about death by decimal. It describes how a single misplaced decimal point in bedside math can instantly turn a therapeutic dose into a fatal error. I'm a clinical instructor and an ICU nurse. My job is to take the complex math from your lectures and show you how to execute it perfectly under pressure at the bedside. Today, we're breaking down the logic behind the desired over have formula. Accurate dosage calculation is a critical safety mechanism for patient survival. This is the core equation. D over H multiplied by Q equals X. D is the desired dose ordered by the provider. H is the dosage strength supplied by the pharmacy. Q is the specific form, like 1 tablet or 5 milliliters. These three variables only work if the units of measurement in the provider's order are consistent with the units on the pharmacy supply label. Consider this clinical scenario. A patient in atrial fibrillation is prescribed a desired dose of 0.25 milligrams of digoxin. The pharmacy supplies 125 microgram tablets. If we populate the formula with these raw numbers, 0.25 milligrams over 125 micrograms times 1 tablet, the math stops making sense. Dividing 0.25 by 125 suggests a dose of 0.002 tablets. The units of measurement in the numerator and denominator must match so they can cancel each other out before you divide. Take a moment to calculate the conversion of 0.25 milligrams into micrograms. Since 0.25 milligrams equals 250 micrograms, we can now plug aligned units back into the formula. 250 divided by 125 gives us the correct dose of 2 tablets. Recognizing this unit mismatch before you calculate is your defense against a death by decimal error. Let's try a new challenge. A physician orders a desired dose of 0.3 grams of Tegretol. Looking at the physical label, we see the pharmacy has supplied Tegretol in 100 milligrams chewable tablets. The order is in grams, but the label is in milligrams. To align the units, we multiply the ordered point 3 grams by 1,000. This gives us 300 milligrams. Physically checking the source label for unit types is the only way to detect a mismatch before the medication ever reaches the patient. Now we can construct the final corrected formula. 300 milligrams desired over the 100 milligrams we have on hand multiplied by 1 tablet. The milligram units cancel out and the division leaves us with a safe administration dose of 3 tablets. At the bedside, always follow this protocol. Write the formula, physically verify the labels, and convert any mismatches before dividing. Subscribe and join us on our platform to continue building your clinical reasoning skills. Your ability to verify and align these units is a judgment that prevents a mathematical calculation from becoming a clinical error.